To matters health, Kenya registered 19,991 new HIV infections in 2024. The increment of more than 3,200 new cases from the previous year undermines the government's ambition of making Kenya HIV and AIDS free by 2030. The government is, however, making great strides in treatment with plans to roll out injectable antiretroviral therapy in 2026 to improve treatment adherence and ease pressure on patients. On the eve of the 41st World AIDS Day, marked every December 1st, Nairobi hosted a half marathon at Nyayo Stadium to express solidarity in the fight against HIV/AIDS and also raise awareness on the scourge. This was informed by statistics which indicated a rise in new HIV infections from 16,752 in 2023 to 19,991 in 2024. The bulk of this were youth aged between 15 to 24 years, the target of declaring Kenya HIV/AIDS free in 2030 notwithstanding.
I have lived with HIV for almost 18 years and actually, I was infected when I was 17 by another person. So life has been full of a bit of stigma, discrimination because I'm out.
As a young person living with HIV, and we know young people do not have access to funds and all that. So HIV si dawa peke yake. We need to have kidney test, we need to have your liver checked so that we know how your medication is taking place. We need to have viral load tujue kama dawa zinafanya kazi. Of course, we take ARVs to suppress the virus. We need to know, is it being suppressed? So hizo tests zote sahi haziko. Those are the services that were withdrawn, but the drugs are there.
Among those which were 15 plus, 41% occurred among adolescents and young children aged between 15 and 24 years. We came together and called upon partners. We called upon ministries and line development and implementing partners and other stakeholders and actors. And we coined the term the triple threat that is challenging the health and well-being of our young people.
Withdrawal of donor funding also caused a major setback, disrupting essential HIV monitoring and testing.
It means that we are going to see more HIV infection because even in terms of people getting their ARVs, the health facility that were user-friendly, where people used to get their medications, have been closed down. So we are forced to go to the main hospital where everybody else is going, and that means there's no confidentiality. And that makes people not go to the health facility to collect their medication because there's stigma, they don't know how they're going to be mistreated, and they have to wait long queues for them to get their medication.
The chief guest, Prime CS Musalia Mudavadi, outlined measures taken by the government in the war on AIDS, key being a multi-sectoral approach.
The Kenya government, through the National Syndemic Diseases Control Council, has developed strategies and facilitated the right environment that allows multi-sectoral interventions and promotes public-private partnerships in addressing HIV and other syndemic diseases. This has enabled all the actors to mobilize resources, both internally and externally, for implementing HIV and AIDS prevention activities.
HIV services are also being integrated in the Social Health Insurance Fund and leveraging of new technology.
We have put in place mechanisms to ensure that we acquire and roll out the latest care and treatment technologies, including injectable ART, beginning next year. This is expected to ease the pill burden that is associated with oral ART, with the accrued benefit of enhanced treatment adherence.
The commemorations included outreach programs, testing campaigns, and educational activities to reduce new infections. Also launched were the Kenya AIDS Integration Strategic Framework and the Kenya AIDS Progress Report 2025, focusing on prevention, community-based interventions, and improving treatment adherence. Doreen Arange for Sunday Express.